we've talked a lot about debt, about like the situation where things can go to collections and the tough spot you can end up in. But I was watching some of your videos on TikTok, and I saw one about a topic that something I didn't even know existed. This thing called, I think it's called care credit cards, that hospitals are issuing credit cards to patients so that they can pay for the ridiculous bills that they've given to them. Am I explaining this correctly?
Yes. So let me explain care credit, because it can be kind of a double-edged sword. It can be beneficial for a patient in some instances, but it's not really beneficial when the hospital is giving it out. And let me explain, because the reason why hospitals are giving this out is because they're having it's an easy way for them to get paid, number one. So they're saying, hey, you can qualify for this credit card, apply for care credit, and then you can put your bill straight onto this credit card. So what's happening is patients are like, awesome, cool, these terms seem pretty good from the credit card company, I'm just going to pay this off. But what happens after that is you lose your negotiating power with the hospital, because once it is paid by the credit card and you call the hospital and say, hey, these charges are not correct, I should have been, applied for this or that, or, something is wrong with this bill, they'll say your account is paid off, we don't have it anymore, take it up with the credit card company. And that's what we're seeing over and over. And that's actually where a social justice law firm got involved in this, because it's not necessarily the care credit card that is the problem. It's the hospital using the card to get out of making these bills right. So that's the issue there. And then the other thing is the terms. You need to be very, very careful of the terms of the credit card. One reason why these credit cards are so alluring to patients is that many of them don't have any interest for a certain period of time. So say you don't have any interest for a year, great. A patient's going to, sign up, because it's essentially like being on a low payment plan, right?
Yeah.
But what's happening is patients aren't able to pay off all of their debt within that time period of the low interest, and then the interest is skyrocketing. We're seeing interest rates of 20% after the 2-year mark. So you got to just be so careful when dealing with those credit cards. If it's something that you want to pay off fast, fine, but make sure your bill is correct before you apply for one of those cards.
So is this different than, I guess I want to say, is this new? Because I remember hearing, like, if you go to a hospital and you don't have the money, they can like help you finance it. Is this like an evolution of that, or is this just like something completely different that they've said, oh, there's a new way we can do this?
Yeah, so care credit cards have been around for a long time. The only difference is now that the hospitals are pushing them more, and hospitals, almost all of them, if not all of them, can finance your bill. So they'll put you on a payment plan. But whenever they do that, the bill is still with them. So you have power still to be able to negotiate the bill. But once you put that bill on a credit card, your account is closed, the bill is paid off, and hospitals are way less open to negotiating your bill if it was charged incorrectly.
Okay, that is a sneaky little
It is. It's
trick they're doing there.
It's a sneaky little tactic, because I have patients ask me that all the time, and they're like, what's the difference between, going on the hospital's payment plan or just, paying off a credit card every month? And that is the difference, is that once you pay it off with the credit card, your account with the hospital is closed out and you lose your negotiating power there.
Wow. I mean, they're doing it. I was going to say, is this illegal? But I mean, they're doing it. Because I guess there's a lot of stuff about the healthcare system. You say, is this illegal?
Yeah.
But it sounds like, is there any pushback on this at all?
Yeah, I mean, that's what we have these law firms looking into now, because they think it's a predatory practice, which is what it boils down to. But, there are many things in healthcare where I'm like, this has to be illegal, and then it's not. It's not. So, yeah, it's surprising, but not illegal.
Wow. I feel like I'm just saying wow a lot to all the details I'm hearing, because it's pretty unbelievable that this is just like, hey, this is just how things are.